Join us now for Let's Just Talk with Kathryn Raaker.
Hi, this is Kathryn Raaker of Let's Just Talk. You know, November is COPD Awareness Month, and our guest today is Dr. Shannon Kasperbauer, and she will provide educational insights about NTM, which is lung disease, in order to alert patients with COPD about the risk. Additionally, Dr. Kasperbauer will explain the signs and symptoms of this condition. I want to welcome you to our show, Let's Just Talk, Doctor. And how are you today?
Great. How are you?
Well, I had never heard of NTM lung disease. So, Doctor, what is it and how is it related to COPD?
Great. So NTM stands for non-tuberculous mycobacteria. And I know that's a mouthful, but these are organisms that are everywhere in our environment. And when they get into the lungs and cause infection, they can cause a chronic progressive infection. So the bacteria are out in the water and the soil, and when they're aerosolized, we can inhale them to acquire the infection. In 2010, we thought the rates were around 86,000 cases in the United States, but interestingly, that rate is increasing by 8% per year. And people with COPD are at higher risk of developing this infection because they have difficulty clearing the bacteria from their lungs. In fact, people with COPD have a 15-fold higher risk of NTM lung disease than people without COPD.
And who is at risk for developing NTM lung disease? And is there a way that they can avoid things that would cause it?
Great question. So the people that are at greater risk are people with chronic lung conditions, including COPD, but that also includes asthma and chronic bronchitis or bronchiectasis. People with compromised immune systems have a greater risk of acquiring the infection. People that are older, so over the age of 65, women are disproportionately affected compared to men, and living in coastal parts of the United States, we know is a risk factor. So 7 out of 10 cases are made up with people that live in the coastal regions of the U.S.
Is there a way that you can, especially if you're on the coastal part of the United States or whatever, that you can actually do something with your house to make it cleaner for you? Is that part of it?
Well, that's a great question. And interestingly, these are things that we all inhale every day. So there's really no way to completely avoid them. They're just a natural part of the environment. But we know that there's higher risk populations that can then acquire the infection.
And how hard is it to get rid of? Or is it just stays with you?
Yeah, so as I said, it's a chronic progressive infection, and the symptoms that would alert someone to having this infection would be a chronic cough, and that might be a productive cough of sputum or just a dry cough. Some people describe chronic fatigue symptoms or just exhaustion. Other patients have weight loss or poor appetite. Some people might have fevers, chills, and night sweats. And finally, there's a group of people that just have recurrent episodes of bronchitis or pneumonia that isn't completely responding to routine medical therapy. So those would all be clues to think about this lung disease if you are one of those people in the higher risk categories. But I'll say that a lot of those symptoms that I just described mimic other lung conditions. They're non-specific. So unfortunately, our patients struggle with delays in diagnosis, and sometimes even out to months or years before they're diagnosed.
Well, let me ask you this question about the cleanliness before we talk about who needs to be tested. Couldn't you be cleaning your air filters and having your furnace cleaned and certain things, especially, because even on the coastal end of the world, it does get cold in the wintertime. Does that change things?
Not that we understand. I think that there's probably a lot of factors that are poorly understood because these, like I said, you're going to inhale this every time you take a shower because these are ubiquitous in the environment. So there are really good resources, though, to thinking about environmental factors. And I'll just point out 2 websites that I'd like to alert your viewers to. One is aboutntm.com. And there people can learn more about NTM lung disease and certainly talk about the signs and symptoms that they could go to their provider to move forward with a diagnosis. And the other is ntminfo.org. And that website connects patients with other people in their community that have NTM lung disease, either through online forums or local support groups.
So it's really important if you suspected to be tested for NTM lung disease. And, if you're like me, my family has asthma. My mother probably had NTM before she passed away. But why is it so important for these people to be tested? Because this could linger, correct, and get worse?
Right, absolutely. So it's important to get tested because, as I said, it's a progressive chronic condition that can go undiagnosed, and then people can develop permanent damage to their lungs if it's not treated. And the people that are familiar with the diagnosis and treatment are typically either infectious disease providers or pulmonologists, and they'll perform a history and a physical exam, but they'll also order sputum cultures in addition to ordering a CAT scan of the lungs. And those 2 diagnostic procedures are critical to make the diagnosis of NTM lung disease.
And what do you treat it with, doctor?
Yeah, so if the physician recommends treatment, it's a cocktail of antibiotics, so not just one antibiotic. And in general, that's administered for several months. And the whole goal of treatment is to render someone's sputum culture negative, so we're not able to find the organism in someone's lungs any longer.
Well, a lot of women are caregivers to their husbands, and hopefully the husbands are caregivers to their wives, right? Especially when people get older, right? That you take somebody with you when you go to the doctor, right?
Absolutely, and it's always good to have an advocate there. And I think it's important to recognize if you or a loved one is having some of these chronic symptoms, to understand that this is a possible underlying cause of those symptoms, and it's pretty simple to be tested. The sputum cultures are routine, and having that conversation with your provider is important to know that they're sending those mycobacterial sputum cultures.
I can't thank you enough for your service, doctor, and what you do, and helping people to understand what the disease is and how to cope with it and the risk with it. And can you give that website out one more time?
Absolutely. So the first one was aboutntm.com. And the second website I mentioned was ntminfo.org.
Thank you for joining us today on Kathryn Raaker's Let's Just Talk TV. Thank you.
Thank you, Kathryn.